Shalom, Erev Tov, good evening, good morning. I think it's still evening in Germany. I'm just blown away by how global we are. So my name is Dr. Tova Goldfein. We are live here on Facebook, streaming from Israel. And I'm happy to introduce you to my co-host. Hi, Rose.
Good morning, Tova. Welcome to Dr. Brosh. He's actually an Israeli living in Germany, and he is a integrative medicine doctor. Have I said it the right way?
I guess you can call it in many ways because it's it's dealing with many things at once. So that's quite correct.
Yeah, he bases his medicine with nutrition, with natural healing, as well as being a medical doctor. He also has a history that he'll probably tell you about of having a back injury. And I think he has a first-hand sort of description of what it's like to have somatic pain and then to deal with it. Would you like to share some of your personal story and then some of your medical background and also the things that will help patients that have got chronic pain, chronic back pain, IBS, all those sort of things that you deal with on a daily basis? They'll be lovely. It would be lovely if you share that for our viewers.
Okay, so I'll just start, and if you have any adjustments or things you would like us to go deeper into, just let me know. So I have been a doctor since the year of 2006, and I have seen. I'm a general practitioner, and I had seen myself. I would say, like every other GP, thousands of people suffering from back pain or neck pain or sciatica, those very common, highly common problems. And I knew that there is some relation between emotions and pain, but this is not something that you learn in medical school. So pain medicine in medical school is a very traditional kind of learning or teaching, and it focuses mostly on injections, surgery, physiotherapy, which all are fine, but there is, to my recollection, there is not so much emphasis, to say the least, on the mind-body connection in pain. Not to mention brain research and the neurophysiology of pain. All of that is quite, I would say, restricted. And the shift in my personal life, also in my career, happened when I myself suffered from a bout of back pain with referred leg pain. I did know what back pain means because I used to have lower back pain episodes, which normally lasted a week or so, once and then twice and then 3 times a year, starting at the age of around 27, which was back then due to martial arts training. That was the first time in which I injured my back. And ever since, I've had these bouts of pain once, twice, then thrice a year. And it lasted 1 week and then resolved kind of spontaneously. But then it was already 7 years ago, just around my 39th birthday, I decided that I would like this time to really treat my back. So to do some preventive measures. And then I went to a chiropractic session. And so I went there. The first treatment was very good. The second one was also good. But then one day afterwards, I began feeling this pain in my low back, and then the pain started like creeping down the left leg. And I was, like, as a medical doctor, I immediately understood the consequences. I immediately realized that this is something that has probably to do with a bulging disc or either a prolapsed disc, disc herniation and stuff like that. And I knew immediately that in 90% of the cases, it resolves itself without intervention in 2 to 6 weeks. This is what's written in the medical textbooks. So I waited this time, and by the way, the pain was not, as we will discover, was not caused by the chiropractic treatment, which I later discovered. And I waited this time, and the pain just continued. And 2 months went by, and then 3 months went by, and then I said, okay, so it's time to do an MRI. I went to orthopedic doctors, to colleagues, to have my back checked. And then an MRI was performed, and it was like quite of okay for the age appropriate, but then there was a bulging disc in there. I really needed to, like the orthopedic surgeon, he said, yeah, it looks okay. And then I needed to really look into it. I said, like, this is not possible because I have symptoms of a bulging disc. And then I really needed to look very carefully into this MRI, and I found the bulging disc. It was a small one, but it was there at the L5-S1 region. But my pain was referred to the left leg, and this disc was bulging to the middle and to the right. And at the time I said, okay, so like I noticed that, but I said, but there's no other explanation, so it's probably that. And then that was the diagnosis, apparently. And then months went by, and I really tried, like, everything that there is out there, both on the medical level. I got injections to the back, and I did lots of physiotherapy sessions, and I did osteopathy and more chiropractic and reflexology. I tried, those exercises when you are lying on your back, your legs are lifted on a chair, and then you have to move the pelvis to the right and to the left, and you're supposedly strengthening your core muscles.
Like the pelvic tilt? You think the pelvic
tilt?
Low doesn't matter. Go ahead. Lamshik.
Okay, so it's like, but you can definitely ask questions about what I do.
No, I'm curious about, like, so now it's 2 years. Are we 2 years into
No,
this?
much more. It's like
Whoa.
I recovered already at the year of 2014, so it's 6 years.
What were you thinking? Like, I want to know what you were thinking, and were you judging yourself, and were you angry? Were you like, what's going on? How did you're the doctor, and here you were. Tell me about that.
It was a humbling experience, I must say, because you are, and you're supposedly everything that I wouldn't say, but you know a lot of what's going on, what you're supposed to do, and what's supposed to happen. Both since I worked as a doctor, also in alternative and complementary medicine practices, then I knew many methods also on the alternative spectrum, and really nothing really helped. I went swimming, because that's the recommendation. Don't run, don't walk, swim, go swimming. Don't lift, all those restrictions. Don't bend like this, don't bend like that. And really there was no resolution. There were a few things that helped temporarily and partially. Yeah. So I've had the TENS machine, which is like some kind of electrodes that you put to reduce pain. Many of the sorts, the chair that I'm sitting on was a chair that I bought back then to support my back better. It's a good chair, but it didn't resolve the pain.
So what made the connection to you that it was stress?
This came later because I was like, at a certain point, I was beginning to feel like somewhat okay. I couldn't function freely. I couldn't function normally. The pain was there, but I kind of went back to doing considerable amount of things. And then we went to a holiday, and I couldn't still carry suitcases, for instance, but I could drive a car. That was very possible then. But then we went to a water park, and with my stepdaughter, she went up a slide, and I said, well, you know, we're on a holiday. I'm feeling quite okay. What could happen when I go up and do one round? And then just at the middle of it, I was beginning to feel that something is beginning to be a bit shaky in the back and the legs. And when I went down, like when I finished this round, the pain was so excruciating. And we had a very long drive back home after this holiday. And then, of course, I needed to lie in bed. And again, and normally it would take, I don't know, it was like going back to zero, to the beginning point. And normally it would take me 2 to 3 weeks. When this happened during these long 10 months of pain, it would take me 2 to 3 weeks just to begin going out of bed. And then I was thinking, okay, so what's the next step? I was beginning to think surgery. And then I said, okay, so I'm willing already to consider a surgery. But then, like, it was this attempt to try and avoid surgery. And then my wife found a blog post written by a woman that sounded pretty much like my story to her. So this woman was describing her pain, and she was saying that her pain resolved after reading a book by an American doctor.
Oh, wow.
And like, I was, okay, bring it on. I'm willing to try everything, because otherwise it's just like, it's surgery, which surgery is not a bad thing. It's a good thing when it's in place and for the right diagnosis and the right treatment. But I was still trying to do something that would be more like a conservative kind of treatment without surgery. And then easily enough, we found the book on Amazon and ordered it, and it came the next day. It already came, and I was lying in bed just beginning to read. I couldn't do anything, so I've had lots of free time just to read. So I was lying on my back reading the book, and I remember that the feeling struck me, just going through the pages, that this book was written about me.
No. It's about me. I'm sorry. It was not written about you. It's written about 3,000 other people. So I just want to, from this point on, at what point, you can tell you, I want to know at what point you realized that it was about your repressed feelings, because this is the key for so many of us. And thank you so much for your humility. Go ahead.
Okay. So at what point I was, Dr. Sarno, he's describing the feeling of rage, right? And I could see that immediately, that like living in, I could see the connection, living in this very civilized, we are all like very civilized. We behave in a civilized manner, but from within, we have this like little child that has wants and needs, and becomes enraged when it doesn't get what it wants right here, right now, And this recognition was very immediate, and I could see that. I worked in the field for quite a few years by then, so it wasn't so foreign to me. And I could see immediately the connection that suppressed emotions could be the trigger of pain. But interestingly enough, I didn't feel that I need to resolve my anger, whatever for whatever reason it was, or the rage, but I just needed to understand that there is a mechanism that can cause pain that originates from emotions, and this mechanism is reversible. So I remember feeling that it's just like, and I know it was written also about you and about thousands, maybe tens of thousands, maybe hundreds of thousands. I guess it's much more than that. But actually, I didn't need to resolve the issue, the emotional issue that triggered the pain. I actually realized what it was 3 months after my recovery. So it took time of like thinking about it and contemplating, but it was not like a must. It was not something that I needed to go through in order to heal. It was more the realization of the connection between emotions and physical pain, and understanding that this pain is reversible and harmless. This was, for me personally, the lifeline, because I was literally challenging myself first to go out of bed and really repeating to myself, well, this pain is real, but it's not going to hurt me. It's reversible. And I knew quite a bit at the time about neuroscience, and I knew that the brain can change. So the idea of neuroplasticity, the ability of the brain and nervous system to change, was not new to me, and it was actually very helpful because I knew that when things like that can happen, they can actually reverse themselves. They can actually change. So our brain is like plasticine in many ways. So this was a great help to have this prior knowledge and to use it, to apply it also to the recovery from pain. So I was literally doing things I was afraid to do before, lest I hurt my back, and really repeating this understanding. It's reversible, it's harmless, you can do it.
Wow. Fantastic. Tell us now, if you don't mind, how when a patient comes to you now and they've told you about their chronic pain, how do you help them? Or do you send them to a Sarno book?
To Sarno's book. Normally the route is such that they first read the book and then they seek professional medical help. But if they didn't read the book, then what I do first as a medical doctor, I first diagnose. It has to go through the filter of diagnosis, because pain could be caused or a symptom of so many medical conditions that you first need to rule out more dangerous diagnosis, like cancer that can happen. It's quite rare, but you have to rule it out. Like inflammatory processes, like infectious processes. So there are many things, and you first need to make sure that it's a benign condition. And then after I do I begin with the medical diagnosis. I follow that up with an anamnesis, like the medical questioning that also relates to TMS.
Ken, I have a copy of that. If anybody's interested, I got a copy from Dr. Schuberner 2 weeks ago, and it's on the PDDA website. So if anybody wants that, I can send it out and explain that. So you have people answer those questions about. Can you explain what that is?
You want me to explain that?
Yeah, just explain.
A little bit, please.
Somebody has a question about TMS. They can get a feeling whether they're, because there's a lot of people come onto these websites, these Facebook pages, and want to know, do I have TMS? And personally, I just want to say to our listeners, I don't particularly think chronic pain. I don't believe chronic pain is normal. I think to a certain point, like you said, 2 to 6 weeks, this gets better. 2 years, 3. I believe the body can heal, and even if there's something physical and organic and structural happening, the way we react to pain is TMS. So I
Right.
benefit from.
That's very, very true in my understanding as well. That's very true. So how can one, what you're asking, Tova, is how can one know or identify that one might suffer from TMS?
This questionnaire, I think, helps people, but you still have to see a doctor and rule out structural or physical. But if there's a tumor, God forbid, or if there's something structural, scoliosis to broken bones to phantom leg, the way our relationship with pain can be helped by the TMS concept and
Definitely.
the ISTDP work.
Okay. Also, when they do the questionnaire, it helps them to self-reflect. And that's what's important about it. That's why I thought mention it a little bit about the type of questions you'd ask, because you'd be probably not getting them to fill out stuff. You'd probably be verbally asking them, I'm guessing.
Right. This is what I do. That's an intake, an expanded, I would say, I would call it like an expanded medical intake. So the questions might be, for instance, about past medical history. So have you had recurrent tendonitis, for instance? Like many so to speak, inflammations in joints. If someone has many of these symptoms during one's lifetime, many times, in many instances, it's actually TMS symptoms in many occasions. And for instance, the symptom imperative that Dr. Sarno described, for instance, having IBS, irritable bowel syndrome, having migraine headaches, or recurrent chronic headaches, having neck pain, of course. Other synonyms or other areas of the body in which TMS could manifest itself in many ways. It could be, for instance, also through anxiety, like an anxious constitution. Many times we see that alternating with pain. Okay, so these are a few examples.
Fantastic. And then what?
And then
when you
sorry.
Yeah. Well, you've asked them those questions and they've affirmed it that that's right. So what's the next step?
So normally I would also ask the people who come, I would also ask them what was going on in your life at that time or prior to that time. What is going on in your life? And this is already a question that brings the person to a sort of a reflective kind of state. Yeah.
And that's what's missing, isn't it? On most when patients go to the doctor, they never ask that question, and that's what makes you so different. That you also want to know what else is going on in your life that would have caused some anxiety or some stress, or even some good things. Sometimes it's even good things that have changed, and they become guilty about that. So then, what happens?
And then physical examination. It's crucial. It's very important to see to check whether the symptoms can actually arise from physical abnormality. And this could be ruled out through a physical examination. Also, it's important to check if there are discrepancies between what is shown on MRI exams, for instance, and the physical examination. Many times, for instance, just today, I've received an email of a concerned patient who did an MRI, repeat MRI, who showed a cyst around one of her vertebrae. And my reply to her was, you do not need to worry. This cyst is just like a random finding. It has nothing to do with your symptoms because it was located on the left side and her pain is on the right. So we really, really need to look into those fine details because these are actually diagnostic details.
They are, aren't they? Yeah. Look, you also have a component of your therapy, I suppose, that covers nutrition and things like that. Would you talk a little bit more about that as well? Because these areas, like Tova always, when she's talking to patients, she'll talk about their exercise and their movement and stuff like that. She'll also ask them about their stresses and things like that. But she also brings in, it's not like you can dismiss everything else. All those other things need to be included. So can you share a little bit more about the extent of your work, please?
Of course. So basically, like what I do as part of a diagnosis is also talking with people about their nutrition. In a doctor's visit, there's not enough time to review 3 weeks of nutrition, for instance, but we do review a typical day of nutrition, and then like nutritional patterns can influence the level of emotions, well-being. It sometimes can worsen or benefit pain, so it can also influence pain. It's not like normally nutrition would not be a sole cause of pain, but it can definitely alleviate or help with healing pain.
Precisely, yes. That's what I mean, like with Tova's exercise. If you're going to do the exercise, you're going to, your serotonin and things like that are going to be raised. So, you know, if there's an iodine deficiency or whatever in their diet, for example, the thyroid will be affected.
Yes,
so
definitely.
That's where I'm...
Yeah, the interesting thing, when Rose taught me about this, you know, a patient will say, well, I feel great when I'm running. So when I have pain, I go running. But the running can sometimes be a distraction from the feelings. So the pain comes back. I feel great when I run and I feel better. I have a cigarette and I feel great. So we're also aware of the defenses. I run and I'm feeling great, but why is the pain still there? So we realize that the running is good. It's okay to have a cigarette once in a while. I'm not against balance of, you know, but then why isn't the pain going away for good? So I imagine you have cases like that also, Nir, and Rose and I were, you know, we want to help people be true to themselves. The running is the running helps me, but the running you know, but there's still stress when you're not running. So I'm getting the cause of the problem.
Yes. So like what would happen normally is like in the clinic, that when someone comes with pain and we discuss also nutrition, they would normally get some tips about nutrition and vice versa. So when someone comes to discuss nutrition and they might suffer from pain, they would get also tips on how to heal from pain.
Right.
I remember, for instance, because we really want, like, I understand that we want the information that what we're talking about that will be able to help also people who suffer. And I remember a conversation with a patient, a young woman who used to suffer from back pain. It was like more the background kind of back pain. And she didn't come to treat. That wasn't the reason why she came to consult. But then it came up and I told her, you know, if you adopt the next, what I'm going to say, attitude towards pain, it's going to be much better. And what I told her is that basically in one sentence, just reduce the level of importance you give this pain.
Yep.
As if you were having like a knob and you can dial it down. If like the level of importance is, let's say 3 in her case, try to dial it down to 2 and then to 1, and then see if you can play a little bit and reduce it even to 0. And actually, I think that changing the attitude is one aspect of helping cope and heal from pain.
Yeah. Yeah. And also when you do hypnotherapy, that's how you know, a person who does hypnotherapy will use that same model to help the patient reduce their pain, get them to dial it down, mentally dial it down, you know, see it on the dial as, you know, it's 10 now, but dial it down to 7. Can you dial it down to 5? Can you dial it down? Yep. So yeah, it's very good way to help patients self-reflect that they've actually got control, because that's what it amounts to, doesn't it? They've got control of the issue. Yeah, when they accept that they need to concentrate on their own lives, not the back pain or the hip pain or whatever. Yeah,
Yeah.
That's yeah. Now, also, what else do you do? You don't just do nutrition.
Right.
On your bio, there's a
I also meditate. I'm an you say avid meditator. You say that in English?
Mm-hmm.
I really like meditating. So meditation is a part of my life. I do it regularly. Try to do it daily. I also I did a few trainings in understanding the psyche in a deeper way. That's a part of the spiritual journey or spiritual path, which helps also with insight that can help other people who suffer or struggle with issues. So I would say that like prescriptions that I give might be, for instance, nutritional, might be around pain, might be around lifestyle. Sometimes it's also insights. We get to speak, each encounter with a new person is always new, and it can always bring about like even creative alleys that we explore together. When someone shares their life, like when someone shares their life story in an open way, then even like essential themes can come up in an open conversation. Sometimes it comes up quite quickly, and sometimes it could also help. For instance, making a decision in an important junction in life. This could also happen. This could also be a part of a conversation or a talk with people who come.
Yeah. The whole idea of making the whole body, the body, the mind, the soul, integrated is really the key, isn't it, to dialing back the pain?
I do believe so. What do you mean by that? I do share this. I feel that I share the same insight, understanding.
Yeah, there's a whole lot of areas that we neglect. Look, earlier on, I wrote it down. Where did I put it? We're supposed to be civilized. That's right. We live in a very civilized manner, but we don't recognize that there's areas in us that are frustrated and harassed and what would you call it? Yeah, there's a repressed anger in us for things that haven't worked out. And there's also an area of our lives that we idealize how our lives should be. But it's about self-acceptance. And that's why, the meditation and sitting with yourself and allowing the thoughts or whatever to go through rather than hang on to them allows that, spiritual life to actually be lifted up. I'm not talking about a religious sort of, because often those areas are areas of defenses that we keep away from ourselves because we've got to do certain rituals or whatever. But I'm talking about that inner life that's there, and it's a spark really from an energetic spark. And one of the things as a therapist I've realized, or when I did this training, was AF. The electrical impulses with AF are being held back because of having to hold all the other problems down. And yet a person with AF goes to the cardiologist, but nobody asks the patient, what else is going on for you, like you do? And if that happened, well, the patient would then be able to self-reflect and say, yes, I'm worse when I'm asked to do something, or I'm worse when I've got to cut the grass and I'd rather watch the football. I mean, I'm making very simple, but the
Yes,
concept.
I understand what you're saying. And you know, by the way, about going to a cardiologist, it is known, for instance, that depression is a risk factor for heart disease. It's no less important than high cholesterol in many ways, and smoking. So we really need to look at the person as a whole, like a holistic being. And you know, there's something interesting about, for instance, on the level of emotions. Many people that come to treat pain, they realize while they're doing the process that it actually comes from emotions. This is what we discover, right? But then what do you do with emotions? How do you manage your emotions? We're not taught that in kindergarten. We're not taught that at school. Our parents, sorry to say that, are many times acting like little children. So we don't have so many role models.
That's
okay?
Right.
So what do you do with emotions, the day-to-day emotions? What do you do when an emotion comes up in you? So first of all, a great discovery for many people who go through the healing process of pain, they actually begin to realize what emotions they are feeling, because many of our emotions are, you know, they're just beneath our noses. They're just like so close to us that we cannot even grasp them or cannot even be aware of them. And when someone, like, the first step is really starting to be more aware of what is going on in your emotional level, in your emotional life, and even giving names to your emotions. You know, they did a wonderful research in bus drivers in California, and they've shown that the people who are less aware of emotions have much more back pain.
Of course, yes. Also, though, neurologically, patients can't they can't connect to it. And it's by your questioning or your type of questioning and making that pattern, that interactional pattern, come alive. This is my interactional pattern, and it was developed, you know, to compensate for the parents that were still children, for example. So therefore, what happens is they stay in that mode and they shut them down. They shut their emotions down because their emotions are just too big.
Yes.
Aren't they? So when they're with you and they actually talk about what happened to them at, you know, like my parents died, or they had a divorce, or my mother was hospitalized, what happens in the room when they tell you that? Do they go to tears? Do they, what happens?
So many times, you know, since in many times, some people go through psychotherapy. So they are kind of aware of their emotions, and some are just revealing what is going on in their psyche and emotional layers. So sometimes it might lead to revelations. So it's like people, they just like realize something. Sometimes it happens after the conversation, by the way. Suddenly there's an insight that came as a consequence of the conversation. And in some cases, it is these are very intimate moments in which someone that you've just met actually is revealing or sharing something which is very deep for them. So this can also happen. But you know what guides me from the outset is to help the other person develop those skills, because I don't want people to depend on the interaction between us. I want them really to be independent in that sense and be able to manage their emotions. So a part of what I do, I've built a whole program to do that, to help doing that, is I teach basic emotional skills, which is being more aware of your emotions. There are actually practices and exercises that help people do that, being more aware, and then naming emotions, and then knowing what to do when emotions flow or they recognize them, which is basically letting emotions flow. So these are all techniques and methods that could be learned.
Yeah,
Wow.
that's true.
So what I find, I think what again, there are people who we had a show on with Marav where we had someone who got better reading the book after 20 years of pain, and someone who reads the book and does everything and has chronic pain off and on, and they discuss their two different personalities. And so, like Dr. Sarno said, 25% of the people, I forget the numbers, but he said, most people will get better reading the book. But 5%, and this was, 1996, 5% will need therapy.
Yes.
So can you talk more about the people that these chronic people that are just stuck, and it's so sad for us to see that.
Yes. So first of all, I must say that my estimation is somewhat different. I have a lot of respect to Dr. Sarno, but I think that most people who read the book do not get better or do not heal completely just by reading the book. They do need to, most people, I would say. This was my assumption when I recovered. I was one of those lucky ones who recovered through reading the book. And that was my assumption. And then I needed to realize through communication with many people that most people who read the book, they understand it, they accept it, they see the reality and truth in it, but they don't know what to do with it afterwards. Yeah. So this was my discovery. So it was like realizing what is out there. So I would say that, for instance, I would say that on average it takes 3 to 4 months to heal from TMS, if it is TMS. On average, it means that some do it quicker, some take longer, and there is a percentage of people who take longer. And I think that some of it could be influenced and some of it not so much, because it really has to do with the resources that the person has, the mental, the emotional confidence.
Yeah. And also, I don't know if you work in this area at all, but it also relates to ACEs, to early childhood trauma. And when that trauma occurred, the ability to self-reflect then gets inhibited, I suppose you might say, with early childhood trauma. So they need a longer period of time. And Dr. Alan Abbas would say they need scaffolding. So initially you help them scaffold. They scaffold their experience and their feelings so that they can cope with them, because they tend to be overwhelming. And then they go into freeze maybe mode and shut down. So anxiety and those sort of experiences need to be titrated so that they can actually see what's happening within their mind when anxiety appears, or they get sweaty hands, or they get cognitive distortions, and recognize cognitive distortions are actually related to the anxiety, not that they have an eye problem or head problem or ear problem. So we haven't actually got any questions, have we?
Yeah, we have listeners, but
Barbara's asked about pain and avoiding sugars. Could you talk about that?
Yeah, I see that. Oh, Rose, I didn't even see that. Yeah.
Can you repeat the question?
There you go. Questions about nutrition. Do you advise people with arthritic pain to avoid sugar?
Oh, that's a very good question. Thank you, Barbara, for this question. Definitely so. So first of all, arthritic pain is a very vast definition, medically speaking. So it really depends on the type of arthritis, inflammation of the joints. But I would say that if one is suffering from arthritis, then sugar is one of the things to avoid. Actually, sugar is one of the things to avoid
Full
for
stop.
everybody. Yeah, it's like
So,
you don't need so much sugar. You know that an average American eats 63 kilograms of sugar per year. Have you know that? Have you known that? It's like a little man.
we're
of
not,
sugar.
we're not American here. We're not American here.
Not American, which is like, I would say, yeah, maybe that's the extreme case, but like really, we don't need so much sugar, and sugar is one detrimental. It's actually a detrimental substance for our immune system, for our heart, for our blood vessels. So you don't want that in your body when you're suffering from arthritic pain. Definitely.
Could you share a little bit more about the metabolism and why it's bad? Because it's all right to say don't drink Coca-Cola because it's full of sugar or whatever.
Yeah.
But why? Can you just point the people into the whole idea that the liver is put under a lot of pressure, and that having absorption of sugar in the vascular system then creates an imbalance in the blood. Just a little overview for people that want to know the reasons, because you know we all get these experts that say, well, we shouldn't have sugar, we shouldn't have salt, and then we should have salt. Just talk a little bit about the physiology of the body and how it has to compensate, and the inflammation that sugar creates.
Yeah. So first of all, Rose, what you're saying is that sugar causes inflammation, and we now understand that inflammation, like not the acute kind of inflammation, not the acute type of inflammation, but rather the more, let's say, the subtle, mild inflammation goes that lasts for many, many, many years. This is really something that is detrimental to our bodies. Sugar in itself downregulates the immune system. It actually influences badly the immune system, so we become less immune, in a sense.
Wow.
It also, of course, when sugar enters the blood, sugar is not a bad thing, by the way. Like sugar is just a molecule. It really depends from where we get this molecule. And the best sources are the whole food sources. When you get the whole food rather than like, you know, this white stuff, or even honey, or even agave syrup, it's all sugar. So when sugar enters our body, what it does, it creates a cascade of events. It influences the pancreas, which needs to now produce more insulin, and this extra creation of insulin influences the liver and the muscles, which develop insulin resistance. And then you get more insulin resistance, you get more sugar in your blood. And more sugar in your blood is actually a cause of inflammation. It blocks the arteries long term. It basically damages blood vessels all over the body. It can influence our vision, creating cataracts. It can influence the function of the kidneys. It can block and clog the arteries that supply blood to our heart, which causes heart attacks and cardiovascular diseases. So these are the effects of excess sugar in our bodies.
Right.
Yeah. But then we also need, you know, I was thinking as you were speaking that fructose is more of a, like it gives you a spike, but it's also more absorbable, isn't it? Like overall.
You mean
like
the white sugar?
apple.
Oh, it seems to stuck. It seemed to have freezed.
Yeah, Rose froze, but she'll come back in a minute. So we've been really lucky. I always feel a little bit interdependent on the internet gods of.
Yes.
So Cheryl comments on the nutrition, and she says,
No. I'm talking about an apple or fructose.
Oh, Rose, you're back.
You froze for a minute.
Back?
You both froze for a minute. So
Yeah. Oh, that's right. Yeah.
good.
No, I was just thinking about when you were talking that, you know, we're talking about white sugar, aren't we? We're talking about refined sugar. We're not talking about fructose and those other sugars. That's all.
Yeah. Yeah.
Yes, definitely. And also it's very important to not to break down things that we eat to, let's say, to too small particles, because none of us eats fructose, we're eating an apple.
Right.
And it's a good idea to look at the apple as a whole, because we get fiber, we get vitamins, we get all sorts of wonderful things to our bodies.
Right.
Exactly. Which we don't get in refined sugar.
Yes.
I'm just trying to point out the difference, that it's not like restricting having an apple is a different situation to having, because you're going to have vitamin A, you're going to have other vitamins, you're going to have I can't think of something with an oil background, avocado, for example.
Yeah.
You're going to have your fat soluble vitamins in those. So the fructose in those is complementary, is what I'm trying to say.
Right. It's a part of a package. It's a whole food package, and it's just one ingredient of it. Right.
So Helen had a wonderful question about childhood trauma. I want to answer that, but I want to just mention Cheryl's comment. So Cheryl's from Australia, and she says, and she's up early with us. Boker Tov, good morning. She says, I'm glad you touched on nutrition. There are so many products out there that I became overdosed and sick from, but the knowledge and warnings are not there. So I don't understand why we are not taught that the body can absorb so much of each, like turmeric or organic oil, both of which she became ill. And it was only then that the doctor asked, what are you eating? So I think it's what you're saying, is that we just have to educate. I mean, we have Google, we have Dr. Google. No offense, Dr. Brosh, we have Dr. Google, and people can be educated on nutrition. And I think we have to take the ball and roll with it. So, and it's wonderful that you're just this one-stop shopping doctor. You can just learn so much in your office and in all that you're learning, and it's exciting to really. So then there's a question from Helen Carroll about childhood trauma. Maybe Rose, you want to answer this, and then maybe Dr. Brosh wants to mention it. Could you say more about the age at which trauma occurred and its relation to healing? What is considered early trauma?
That can be looked at in several different ways. As I was saying earlier, it could be death of a parent, it could be divorce, it could be hospitalization of the child. It could also be childhood abuse. And it's called ACEs, ACES, and it's a score. So when you come to look at your somatic problems, your back pain, your IBS, or your whatever, medically, our medical profession should provide an ACEs score, because that ACEs score will allow them to see what's happened. Now, also in therapy, it takes longer for a patient to unravel, I suppose, the effects of those early childhood traumas. And it comes down to the inability, I can't remember the long word of it, of self-reflection. So we have to titrate the anxiety, titrate the interaction with the patient, even to allow them to feel safe with another human being, because the people that they loved have hurt them so deeply and haven't given back the love. And as I say repeatedly, virtually every time on this program, we were made for love. We are love. We're physically a love machine. But if it's not given back to us, we don't know what to do with it. And we repress our feelings and our emotions. And at the core of all these things is that heart. And the heart has to be covered over and over with defenses, with anxiety, to keep it safe. So
Helen wants to know what Helen wants to know, and Helen, you can always speak with Rose after the show. She always is available for more questions because she's starting her day. But she does want to know, Helen wants to know about what is early? What do you mean by early childhood trauma? What age?
It varies. Like Peter Levine and Gabor Mate will actually describe where the addiction need comes up, or where, you know, it could be like, I've got a lot of references on it. Maybe what I'll do is I'll email you on the chat so
Also,
that you get an idea.
1 to 7 years, you know, is really, isn't it true?
Or 1 to
Dr.
3.
Bush, at 1 to 7 years old, we
1 to
really
3.
1 to 3, we develop our personality. What was that
Yeah, but it's
statistic
about
about
pre-verbal.
age?
Tova, it's about being pre-verbal. When you're pre-verbal, you can't ever express anything. So then you have to begin to learn how to repattern that part of your emotions. And I'm taking the way from NIR, and he probably has more experience than me. So can you come in there, NIR, and say what you've learned?
About what you're referring to, Rose, I think it's very important because we do want to screen for the ACEs. The ACEs are the adverse childhood experiences. And for instance, if someone grows up in a violent house, or a house where one of the parents is an alcoholic, or otherwise there's physical abuse, emotional abuse. Of course, there are cases of sexual abuse. So we want to screen for those. And this is actually something that helps us identify where more help is needed. So we want to adjust the interventions to what was going on, what is going on, was and is going on in a person's life. So in this case, probably more help will be needed, either psychologically or maybe on other levels as well. But I would generally say that an early childhood trauma is, for instance, as children, we do not have the ability, as you're saying, Rose, to self-reflect. So our reaction, our ability to react to a specific event is diminished. Is not as evolved as a grown-up person emotionally, and this could imprint trauma. And of course, it really depends on both the age, the younger. So think about it like a spectrum. The younger age it happens, you can say it's stronger, and also the impact. What happened? What actually happened? The impact is also very, very important in defining
Exactly. Yeah.
the trauma itself.
Yeah. And also the development of the child, the physical development, you know, like vision, for example, doesn't come online properly, I think, until about 10 or 11. Like, you can't let a child cross the road on their own because they haven't got peripheral vision fully developed. And what else? Like the speech, as I was saying earlier, speech comes online. The right hemisphere of the brain has to be integrated with the left. So that corpus callosum area, the emotions are actually, you know, to use layman's terms, they're sort of stuck there. So they have to be released out into the brain fully. Yeah. There's another good question here too.
There's a question also for you. Go ahead. You want to read it, Rose, from Stephanie? It says, my TMS symptoms have been in my back or butt, hip, and down right leg, and calf is tight and shin is sore. It's just started in another shin a few months ago. She journals, meditates, and tries to figure out what she might be missing.
Okay, so all right. So Stephanie, thank you for this question. And here I think it's an opportunity. It's a personal question, and I would like to answer it, even though we don't know each other. I don't know your entire symptom, like the entire story of the symptoms, how it developed, and what was going on in your life. Please pay attention. Sorry, that and this here I would like to actually correct a very common mistake about relating to emotions that revolve TMS. For most people, I would say maybe 80 or 90% of the people who suffer from TMS, what is more important is how they relate to the symptoms themselves. So the emotions that are much more important, in my understanding and experience, are the emotions that revolve around what the experience of pain is causing in your life. Okay, it is much more important, for instance, than going back to early childhood, really digging into your soul and trying to find this repressed rage, which with so many patients, they tell me, but I was looking for rage and I couldn't find it. And then I explain to them that it's a repressed rage. You cannot find it because it's meant to stay repressed. Okay? This explanation, Sarno's explanation, is a theoretical one. He was trying to make the theory grounded. So he needed some reference, which in his case was to Sigmund Freud's work. So don't look for this repressed rage. You will not find it. It's impossible. And
No,
try not. It is repressed, and it's repressed for good reason. And
exactly.
it should stay there.
Yeah.
And
could I just say that for Stephanie to stay in the present moment and see how she reacts with the people she loves and the people that annoy her. And that's her best way of figuring out what's going on, not digging up the past. Like the past will come up for you and it becomes integrated. But the best way is to actually see what you hold back, what you wish you could do, like use that example of biting your tongue. Well, you need to bite your tongue if you want to be sarcastic, but then sarcasm, for example, is a defense against emotional closeness. So I'll write a little bit more about that after the program anyway.
So go ahead, Nir. Yeah. So finish that explanation. So not so important about the deep feelings, as important is how you relate to the pain, how you judge yourself with the pain, how you criticize yourself. Is that where you're headed?
As a part of it, yes. How you criticize yourself, how the pain is causing you to feel. Are you blaming yourself, for instance? What are the consequences in your life? So does the pain, for instance, cause tension? What emotions arise from the pain, from the situation of pain? For instance, do you have any worries reflected at your future? What is going to happen to me? Am I going to be like that forever? When is the pain going to go away, etc., etc.? So try looking for these as well. Okay, and try to see if there's any correlation between the time in which it began affecting the other shin and some thought pattern or some emotional pattern that was related to pain that began emerging at the time. And also be aware, Stephanie, and this is relevant for everybody, that we are living now in a very challenging time in which many people have more stress-related symptoms. So did it have a connection on the timeline with the COVID pandemic? Was that related time-wise? So take care of that as well, because this actually influences many, many, many people nowadays.
Exactly. Yeah. Yeah. Wow.
Stephanie admitted that. She said that, thank you so much. I've not focused on this. And yes, worry is is an issue. And worry is kind of an emotion that you're not really sure. You think you're concerned, you think you're focused, but you're really causing your brain to think there's a lion coming, and all it is, you know, I'm waiting to see how many people got corona today in the Israel news, you know. So Mia has an interesting question to follow up on what you said, Nir, which was so interesting, really interesting. Exactly how to find the rage when it is repressed. Any tips on what to do with that? Like how to find the rage?
You don't. You
Right.
cannot. You cannot find the rage. Like really, honestly, try to imagine Dr. Sarno's image. Can you imagine Dr. Sarno in a tantrum or enraged? Can you really imagine that? Like honestly, really, you cannot, right? So you cannot find this rage. You cannot tap into it unless you're going into, which I'm not. It's not a recommendation, of course. Unless you're going into the deep forests of Brazil and going into a deep shamanistic kind of journey. Okay, you will not be able to find it because it's repressed, and repressed emotions are not meant to be felt or experienced. Okay, unless you're really going into a very deep going process, which is quite rare, I would say. There is a barrier. I don't remember who was describing that in one of Sarno's books, but there is a barrier between the conscious and the unconscious or the subconscious. And this barrier is meant to be there. This is what defines a healthy person. Okay? So you cannot cross this barrier, and you're not meant to cross this barrier. And this is something that characterizes a healthy person on the mental and emotional layer. When this barrier is broken, we call it psychosis.
Right, but what about the fear behind the rage, or the sadness, or the grief, or the guilt? If we recognize that, that's healthy as well.
Yeah, definitely, of course, because there are more, let's say, here we are, and here there are the, let's say, the under the surface emotions, and here, I don't know if you're seeing it, down here are the repressed emotions. You cannot go directly to the deepest. You have to meet first the ones that are closer to the surface.
Exactly. Yeah. And go
then,
down. I often say to patients, it's like we're peeling an onion. You know, like a layer and layer and layer. We take each layer off. But, you know, Mia was saying that she'll never heal when she can't find her rage. But it's not about finding her rage. It's about actually recognizing that there is something else going on and allowing it to gradually out. You know, like.
So pay attention to a question by Mia, which came up, which is a very, sorry, Rose, it's a very common question. And many people think like that. And it's not the truth about TMS. So Mia is asking, so I will never heal when I can't find my rage? Or what's the deal here? You will heal without finding your rage. That's a very important key. And this is something that many people who read about TMS or try to heal through TMS, they make this mistake. They really want to find the rage and heal it and release it in order for them to heal. But you do not need to release yourself from the rage in order to heal. You need to understand that emotions cause real physical symptoms, that the mechanism is reversible and harmless. And basically, this allows you to stop fearing the pain. Because fear is an emotion that perpetuates pain. And the more you release your fear from the pain through this insight, for instance, of Dr. Sarno, the more the pain is released. That's the key.
And that's what Dr. Scrivener said. He said, fear of the pain is worse than the pain. And that was from Dr. Scrivener, who's doing all the studies.
Yes.
So that was a good point.
Okay. Could I also add that it's not about releasing the pain or releasing the rage, it's integrating the rage. Because when you're two and you've got rage, it's normal. It's absolutely normal.
Totally. I totally agree with you. It's really beautiful what you're saying, Rose, that it's like, it's more integrating what is in there. By the way, even if we don't completely grasp or understand what is going on in our psyche.
Exactly.
That's beautiful.
I think it's part of the control. I want to release it. I want it to be gone. It's like letting go of it is control. And that's, you know, so many of our wonderfully smart and brilliant and wise, you know, patients, it's part of the ego. And Rose will call it the punitive ego. That won't allow them to like be okay with being in pain. It's like it's a conflict, and it's, you know, it's a paradox. So I'm really happy that you came to speak, to give our listeners your take on it, which is what Rose and I do and what Sarno did, but we're all going a little further than Sarno. And he would be right here. He'd be reading the Presence Process. He'd be hanging out with David Hanscom. He'd be coming to Germany and visiting you. You know, he'd be studying with the guys. But like, he didn't get that far. But so we all have to give him credit. But then we're like taking the ball and going a little further with the neuroplasticity and the understanding of the child. It's so beautiful what you're saying. And can you tell us a little bit about your book that I hope that you'll translate to English now that all of our listeners are going to hear?
That's the next step. Actually, Tova, this is the next step. It's about to begin quite soon. I've written a book about my personal journey and also the insights that help afterwards patients in the clinic. And it combines also lots of science, but not like too complicated, but rather in a way that would be understandable and accessible, which that was part of my intention in writing the book. And basically, I think it's one of the books in the subject that nowadays there are more, and it's really, I think it's very, very good that it's happening. This education needs to go out. So my book is a part of the education that Hebrew readers can get about pain, about chronic pain, about how to manage it better, about how to heal from it. And what I try to do is to integrate the insights, which Sarno already brought, with exercises and practices that are practical, that people can actually use. So when you go through the book, through the pages, you can actually look at it as a course you're going through and going through stages. And I do get letters from people from time to time who tell me how they manage to either heal or better manage their pain or get insights about other chronic conditions.
Yes. You've also translated into Deutsch, haven't you?
Not yet. I was planning to do it this year, but COVID came and just like kind of we need to shuffle the cards again. So it's going to be first translated to English because it's going to be faster. And then I hope it will also go to the next step and be translated to German.
Okay. So it's going to English next.
First is English, yeah, next step, yes.
Nia, thank you so much.
Yeah.
I hope that our audience have learned a lot, because you've given them a lot of information, a lot of very valuable information. And also they can see that a medical doctor has got an understanding of how emotions affect the body. And unfortunately, in our mainstream medicine, psychiatry is kept away from the body. And yet, you know, like doing this ISTDP therapy, and as a nurse, when I did the training, I'm looking at it and I'm thinking, oh my God, AF is involved with, you know, IBS. I'm looking at all those things and seeing all my patients over the years, and postnatally.
Rose, come back, Rose.
Yes,
how women couldn't breastfeed, or they had problems breastfeeding. So thank you.
And thank you also for inviting me to this conversation, and also for all the people that joined us. I felt that we managed to share very interesting and important, and hopefully also insights that also hopefully help the listeners in their own journeys towards health. And I hope that we've managed to, I feel that we've managed to generate a positive and optimistic view of what is possible. And so thank you so much. It's been a true delight speaking to you.
Okay. Wonderful. Erev Tov, thank you so much again. We'll have you on again. We'll have you on again. And
gladly, I'm in.
Thank you so much. Good night, everybody. Good morning, Rose. See you next week.
Good night, everybody. Good morning, Rose.
Bye.
Bye.